Jeff Teckman. I'm a physician and scientist and researcher at St. Louis University School of Medicine and the chairman of the Department of Pediatrics at St. Louis University and at Cardinal Glennon Children's Hospital. As we learn more about how people's bodies function, we are able to nail down very carefully many, but not all, of the differences between people. Now that would seem, obvious on the surface, but when it comes to medications and treatments, it actually becomes very complicated. So as an example, if you go to the store to buy a bottle of sunscreen, you might use it, I might use it. But precision medicine, what that would mean was that you would have a bottle of sunscreen designed for your skin tone. So very light-skinned people who are more susceptible to sunburn might have a different type of sunscreen than a darker-skinned person who's much less risk. So that's an example of precision medicines. But when we really talk about it in modern terms, we talk about more than just observing what someone's skin tone would be as an example, but really looking at their DNA. What are their genes? What's the difference between our genes? There are very slight differences between all of our genes that determine who we are and why we're different from another person. Those genes not only determine our skin tone and our eye color, they determine if we go bald, they also determine how our cells function, how our organs function, and how susceptible our organs are to disease. And likewise, how receptive and effective treatments might be. So in this modern era, precision medicine really means understanding your genes, your DNA, how your cells function, and how we can match a treatment to that specific person's DNA or cellular function and make it better than just giving a treatment we would give to anyone. We may treat a patient with what we call inflammatory bowel disease, or some people know that as Crohn's disease or ulcerative colitis. So these are conditions which are not rare. We use medicines in those diseases to reduce the immune system's attack on that person's own body. We will actually alter the dose of medicines based on the individual person's inherited metabolism of that medicine. And that reduces the chance of side effects and maximizes the positive effects. More and more, we are able to look at a panel of genes in an individual person, look at the characteristics of their genes. Again, as a hair color gene, is it blonde or brown or red? There's also the gene for metabolizing these medicines, and then there's several different types. And by knowing that type, we sometimes are able to pick an antidepressant medicine, which is going to work better on this person's depression than it is on another person. People are also very familiar with this in terms of cancer treatment by looking at specific differences between people's cancer. So not all breast cancer is the same. Some breast cancers, the cells are acting in a certain way. Some breast cancers are feeding off the patient's hormones. And by identifying exactly how those breast cancer cells are functioning, that can determine this chemotherapy is going to work better or this one. So this is something that increasingly is really able to fine-tune treatments for all kinds of diseases. As we learn more about genetics and how the body functions on a very specific way, this is going to lead to some great breakthroughs in the near future, and already has, actually, for present care. But it has a huge impact on public health. Even a modest improvement in outcomes in one person, if you can multiply that by the population, if you can improve breast cancer outcomes and improve survival by a few years, but you multiply that by all the people with breast cancer, you all of a sudden get thousands of years of survival out of applying this new technology. Now, not only is that good for people want to survive, they want to live longer and healthier lives, but it also is good for our entire local towns, the economy, the state, the nation, the world. It's more years of earning, more taxpayers, more raising children without, who have not lost their parents. It's contributing to the economy. It's contributing to all kinds of new discoveries and things those people would have done in their work lives. One of the key things we haven't talked about is privacy. And I think that's always on people's minds. So, people are concerned about your social security number getting out, right? What about your fingerprints? This is even more so. This is an incredible identifier, your DNA. And in fact, the government and agencies that regulate human research, there's a list of things that identify people that have to be kept private. Your name, again, your birthday, things like that. Your DNA sequence has recently been added to that. So because we can identify you from your DNA sequence. And with computers now, you think, well, if I have my DNA sequence in somewhere, who's going to find that? Who's going to look at that? Well, who can steal your identity? Who can steal your credit card number? They may steal your DNA sequence. And in the future, there may be repercussions for that. Privacy, financial, all kinds of repercussions. So I think that, privacy in a lot of settings is very, very important. I think we've become aware of that in the last decade, since whenever time we go to the doctor, we have to sign the privacy thing. And I think people maybe don't understand how that really got started. The whole HIPAA, was really, as technology and rapid communication and computers really got going, people were having consequences, and it became evident that we need some way to protect privacy. The problem is a lot of that law is actually focused on not letting it out, as opposed to the repercussions or the punishments for misusing it are still relatively weak. It's not zero, but there's a much stronger focus on not getting the information out than there is on not misusing it, which I think is something our society is going to have to really deal with, right? I think we need some stiff consequences for misusing data and privacy information, just like we have stiff punishments for stealing your credit card number and buying a new car with it. We have, tremendous ability to treat diseases that even a few years ago were fatal or debilitating. We've made great strides, but we have to be able to get those treatments to people. And increasingly, we have this divide. We have people that are well-to-do, they have excellent insurance, they have solid employment, and then we have other people at the other end who are often working. We have a large population of people that work full-time and pay their taxes, take care of their families. But they have very limited access to healthcare. And so the greatest technology ever isn't going to help them. How do we get the benefits of technology and the benefits of new discoveries to every American, every Missourian, and not just the top 1/3, and people that live in rural areas as well as urban areas? Again, the rural health crisis is really big.
Thank you so much, Dr. Teckman. We talked with Dr. Teckman about the history of genetic research, some of the basic principles of precision health, and about how precision medicine can be used to improve patient care. Dr. Teckman also discussed some challenges associated with precision health, that not all patients can access the best technology, and that sharing genetic information may present privacy concerns. Next, we'd like to showcase the University of Missouri NextGen Precision Health Institute, led by Dr. Richard Barron. NextGen will be a state-of-the-art research facility to help address some of the greatest health challenges facing Missourians through precision health research. Enjoy!
We knew that we had to advance the University of Missouri research. We felt very strongly that research was not being advanced as it should have been, that Missouri was falling behind other states in the new pharmaceutical, biomedical, biotechnical industries.
We are 12th in the nation in rate of cancer death. We're 11th in cardiovascular causes of death. And most of our counties are underserved by important health resources.
We're going to soon have a building that will be filled with some of the best and brightest researchers in the country, and we'll be achieving the results not just important to Missourians, but important to all of humanity.
On the street level, there'll be these beautiful plazas leading over to the hospital area, but underground will be tunnels connecting it with the physicians' buildings so doctors can run immediately from seeing patients in the clinic into the NextGen facility and then do research of whatever kind, either wet lab or dry lab.
It's a very high-tech laboratory building with some important resources in it. A human and animal imaging facility in partnership with Siemens, an electron microscopy core that is going to be state-of-the-art and allow things to happen that have never happened before.
They're going to put in a 7 Tesla magnet and a PET scan in the same facility for research, and that's just the basement. One of the unique pieces that this campus has is the nuclear reactor. The reactor was recently used to come up with a compound to treat pancreatic cancer. And we're sort of doubling down on this investment, and we're bringing in some amazing talent. Dr. Carolyn Anderson from the University of Pittsburgh is a world-class radiopharmaceutical researcher.
The Missouri University Research Reactor, where we produce the radionuclides. We're going to be testing them at the center that I'm going to be in, across the street from the reactor. And then we'll bring them to this new NextGen building, and that's going to be where we do the first in human.
We will have veterinary medicine, working with the medical school, working with the Orthopedic Institute, working with clinical physicians, working with researchers from around the state.
It's been incredible to see the progress on the building. This project is extremely important to our future as an institute of higher education. And it's also meant a lot that there are so many alumni from our universities who have been on site as part of the project.
This is really a bold move by the university that involves all 4 of our campuses to create answers to health issues not only now, but throughout the coming years and coming decades.
We believe that by having this amazing array of not only scientific talent, but then also scientific tools, you don't have to go to the Mayo Clinic. You don't have to go to MD Anderson. You can stay right here at the University of Missouri in Columbia and get cutting-edge medical care.
We will see the solutions to some diseases that have not been able to be treated. We may come up with the cure and the treatment for the next pandemic before it occurs, just because of this opportunity.